Wisdom and joy can be passed down through the generations. So can awareness about heart health. That's what this program is about, your health and the health of your family, so you can celebrate life together.
Hello, I'm Malcolm Taylor, President of the Association of Black Cardiologists. As President, I'm often asked, how come the Association of Black Cardiologists has a women's center and not a men's center, particularly when men are less healthy and have a shorter life expectancy? I think UN Secretary General Kofi Annan said it best in a New York Times article. He said, study after study has shown that there is no effective development strategy in which women do not play a central role. When women are fully involved, families are healthier. They are better fed. Income, savings, and reinvestment go up. And what is true of families is true of communities and eventually of whole countries. In American society, women assume primary responsibility for child care, the health of their families, do the shopping and the cooking. If we educate and motivate women about how to improve the family's quality of life and longevity, everyone benefits.
The African American woman needs to see not only where she is today, but where she has been.
I'm a great-great-grandmother.
This is my mother, and she lives on her own.
And I'm Jesse's daughter, and I'm third generation, and I also have 3 daughters.
Well, I'm one of Doris's daughters, and this is my daughter, Lorraine.
I'm the youngest except for my cousins.
5 generations coming together to celebrate. This doesn't just happen. Staying healthy is a choice. We're going to explore the choices made by Luella Griffin and the growing family that calls her Mommy. And we are privileged to provide insights from the great Maya Angelou, poet, author, historian, playwright, producer, director, actress, civil rights activist, and professor. She is celebrated as a leading voice of this age, and her words often praise a woman's power to nurture and lead.
The woman herself deserves to be in her best possible shape. And the children, I deserve her to be in her best possible shape. And then her man, her beloved, deserves it. He might even get into his best possible shape if she did.
Good health starts by paying attention to yourself and paying a visit to your doctor.
5 years ago, I couldn't get my breath, all like that. And I've been going to a doctor from then on ever since.
Mommy waited until she wasn't feeling well to see her doctor. It's a much better idea to go in every year, even if you're feeling fine, because heart disease does not always announce itself with symptoms. And heart disease is dangerous. It kills more women than men, and it kills more African American women than white women.
I think that women don't perceive their major health risk as being heart disease. If you poll women, most women will identify breast cancer as their major health risk. In fact, cardiovascular disease kills more women than all kinds of cancers combined. African American women, for many reasons, have a higher risk of heart disease, and they also have a higher mortality. That is, they're more likely to die when they do develop heart disease. So I think it is extremely important for African American women to be aware of what their risk of heart disease is and to take action, to do something about those risk factors.
Bring it up.
In a nationwide effort to awaken African American women to the dangers of heart disease, prevention programs like this one, called Generations, are going on in churches, at schools, clinics, and other community centers around the country.
Okay, right hand up. We're going to do a big finish.
While a range of illnesses are covered by the term cardiovascular disease, the first step toward prevention is the same: awareness and education. Let's start with two of the biggest dangers: heart attack and heart failure.
A heart attack happens when the artery that supplies the heart with blood becomes clogged by cholesterol. So that's the one kind of heart disease. The second very important kind of heart disease is what's called heart failure. And that's just a term that describes the inability of the heart to pump blood effectively. And that can happen for many different reasons. One is having had a heart attack. Long-standing, untreated high blood pressure, which causes the heart to have to work harder, can also result in heart failure. Certain kinds of viral infections, diabetes can also promote the development of heart failure. Those are the two most important kinds of heart disease that we see in Americans today.
But heart disease doesn't stop there. It's often called cardiovascular disease because the word vascular describes the entire blood delivery system in the body. Damage to this system can lead to problems ranging from pain to high blood pressure to a stroke that can be disabling or deadly.
If you have poor circulation to the heart vessels, you'll get chest pain, and people know that as angina. When you have poor circulation going to the blood vessels of the brain, you may have a stroke.
Knowledge is power. With an understanding of your risk, you can take action to protect your heart health and the health of your family.
The patients that are at risk for heart disease are patients that have the risk factors for heart disease. They include cigarette smoking, high blood pressure, diabetes, and elevated cholesterol, or a strong family history.
Managing the risk factors of heart disease is something every member of the family can do at every age. Mommy is in her 9th decade. Maya Angelou is proudly older too. The difficult days of her childhood in the segregated South are long behind. She has won international acclaim and the applause of presidents, and she has learned to nurture herself as she nurtures the flowers in her garden. And she has good news about the later years of life.
The 50s were hard. 50 was good, but oh, the 60s. Listen, if you can, live until the 60s. And then probably, if you're really lucky, live into the 70s. By the 60s and 70s, you've made a place for yourself. Whatever it is, if you're teaching, if you're working as a secretary, if you're working as a forelady, a foreman, if you're working in construction as a woman, if you're working as a builder as a woman, or a doctor, by your 60s, you've made the world, your world, know that you exist.
Mom is Chauncey's good great-great-great-grandmother. Yeah.
Jessie's in her 60s. Mommy's daughter, she lives with her daughter Doris, and Doris's youngest daughter. With girls and women of all ages in the family, they try to make heart health a conscious part of their lives.
Now, seeing my grandmother with heart disease, I know now that that is something that could happen to me.
It's important to know what health issues are part of your family history so you can understand what kinds of heart disease you may be at risk for.
Well, like many other diseases, heart disease tends to run in families. The risks for heart disease, such as high blood pressure, diabetes, or high cholesterol, also run in families. You can't pick your parents, but you can identify those risk factors which you may have inherited, which can be modified. And that's why it's important to know the family history.
Mommy's family knows she has a heart disease that's very common among African Americans: high blood pressure or hypertension.
High blood pressure, which is very prevalent in the African American community, is an inherited condition in which the resistance in the blood vessels outside of the heart is higher. When that happens, the heart has to work harder to pump blood against this increased resistance. It increases the likelihood of developing cholesterol plaques in the blood, but it also damages the heart directly by causing it to have to work harder and enlarging to an unhealthy degree.
Since 1 out of every 3 African Americans has high blood pressure, everyone should get checked at least once a year. You probably have heard the numbers at a checkup, one number over the other. The number above, called the systolic, measures the pressure when the heart is beating. That should be 120 or less. The lower number, called diastolic, measures the pressure between beats. That should be under 80.
This is one that talks about salt content.
People with high blood pressure are usually told to reduce the salt or sodium and fat in their diet and to increase their exercise. It's also a good idea to find ways of reducing or managing the stress in your life. Along with those lifestyle changes, medication is often prescribed. Remember, for most people, healthy blood pressure level is 120/80. But if you have other health conditions like diabetes or kidney disease, your goals might be different. So ask your doctor for your own blood pressure goals. And when you reach those goals, continue your medication and your healthy habits because it's important to maintain your ideal blood pressure.
Hypertension or high blood pressure may have no symptoms early on until organs are damaged by the increased pressure. And the damage can result in either death or in major disability. So even though you don't feel the symptoms of high blood pressure, it's extremely important to take your medicine every single day.
That's something that bears repeating. Even if you feel okay, you should take your medication. And even if you're feeling fine, you might have heart disease. Sometimes there are signs, but they might not be obvious.
Women with heart disease may have the common symptom of pain or pressure in the center of the chest, but in women they may also, at a much higher frequency than men, have other symptoms such as shortness of breath or episodic fatigue or dizzy spells, passing out spells, symptoms that we don't ordinarily think of as associated with heart disease.
Hi everybody. As Beverly said, I'm Karen Blanchard.
Of course, we can all live better by living in a way that helps prevent a crisis from occurring. That means learning the basics about a lifestyle that supports heart health, starting with the food we eat. It doesn't take long to learn the basics, to find out that too much salt can be a problem for people with high blood pressure, that canola and olive oils are better to cook with than saturated fats like butter, lard, and shortening. To see where dietary fat might be overloading your meals in the form of eggs, whole milk, chicken skin, bacon, and red meat, and to memorize 3 important words: moderation and portion control.
Well, we're inundated with large portions in restaurants, and that kind of goes into the home setting too, and we look for more on the plate.
Here's a heart health challenge. Imagine you're the leading lady of fabulous food in Harlem, and you find out you have high blood pressure. At 77, Sylvia Woods still runs the restaurant that bears her name, but something was slowing her down.
I truly was unable to meet and greet my customers as I always have done. I could not. I would have to hide in the office because I couldn't walk to them.
Sylvia went to Dr. Mendez, and soon she was feeling much better.
Dr. Mendez put me on the right track, got me started on my way, and now I'm not just walking around to meet my customers. I can really run. Sylvia's coming through, and when I say that, move out of my way.
Sylvia makes sure to take her medication every day, and for her blood pressure and her overall health, she's also paying closer attention to what she eats.
I used to eat everything, but now I really be very careful what I eat. I love vegetables, string beans, collard greens, and a salad every day. Most of my food I grill or bake. Instead of taking care of everybody else, I'm taking care of Sylvia.
The next time your family gets together for a celebration, talk about the way you choose and prepare your meals. A key ingredient you should try to leave out, the kind of cholesterol that is harmful.
Cholesterol is a natural substance that's found in everyone's body. Your body produces it to make parts of the cells of the body. Unfortunately, if there's too much cholesterol in the blood, it moves into the blood vessel walls and can build up and actually block the blood vessel walls off.
Your healthcare professional can do a quick blood test and tell you if you have to be careful about your cholesterol levels and your level of another substance called triglycerides. Those are big words, but they can be boiled down to simple advice when it comes to choosing what to eat.
By changing the diet to include more fiber, more whole fruits and vegetables, less salt, and less saturated animal fats, we can dramatically decrease the risk of developing cardiovascular disease.
So learn to read labels. Try to keep a lid on dietary fat and sodium.
It's important for women, particularly African American women, to be aware of heart issues, because there are things that they, as the major provider, meaning the cook, the person that feeds the family and prepares the meals and shops for the family, has an opportunity to make sure that the foods that are delivered, that are provided, are foods that are low in cholesterol, low in salt, and are healthy for someone who's at high risk for heart disease.
All through the day, you can make changes in the way you prepare old favorites, like the way Jessie has learned to flavor her midday meal.
I lay off the salt, but I have to have my pepper. And I squeeze lemon juice on it so it can give me some taste, and a tomato.
When we do cut them up, we make sure we cut them into small pieces.
And Jessie's granddaughter, Toya, has learned from her great-grandmother, Mommy's heart disease that she must be more careful, too.
I try to eat more vegetables, drink more water and juice instead of, caffeine. And also I try to teach that to my boys as well as my husband. Instead of frying foods, we bake.
Doris Hill has an additional concern. Her mother, Jessie, is diabetic, so she knows she carries a risk for developing that disease, which could place an additional strain on her heart and blood vessels.
I try to keep myself checked periodically. I go to the doctor, and they do a blood test on me to see if I am diabetic. So far, I'm not.
Diabetes mellitus, or what we usually hear of as sugar diabetes, means that your body is unable to transport glucose, which is the commonest sugar in your body, into the tissues, where it's often used as an energy source. Diabetes is very damaging to the blood vessels, and so those individuals who have diabetes are at much higher risk of having a heart attack, heart failure, or a stroke than individuals without diabetes.
The most common kind of diabetes, type 2, is striking more and more African Americans at younger ages. A tendency toward being overweight and less active is suspected as the reason. So in addition to making healthy food choices, make exercise a family habit.
This is certainly something for all ages, and quite frankly, it's very important that we let our children know that an active lifestyle is so important. Exercising early on is something that you'll keep for the rest of your life.
Tanya Hill knows you don't have to go to a gym to get exercise. She has had a lifelong example right in front of her, Mommy.
I watch my great-grandmother all the time. She's never sitting. You'll find her up sweeping, doing something, getting her heart pumping, getting her blood circulating, and I try to tell my daughter to do the same. Go outside and play.
My great-great-grandma, she teaches me to stop eating candy and eat my food more, and to just do my homework and not watch television all the time.
Exercise is not only fun, it can help prevent the onset of diabetes. It can lower your blood pressure. It can strengthen your blood vessels. All kinds of good things for people of all ages. And if you make music a part of your life, Like the Harlem Girls Choir, you just can't keep from moving.
Now, it's important to recognize that physical activity at any stage in life, whether children, adolescents, young adults, or mature adults, can reap benefits in terms of heart health.
Let's go. 1, 2, good.
If you have not been active and want to get started, it's a good idea to check with a healthcare professional about what's right for you. But don't let your old ways get in the way. And don't look for excuses. Look for opportunities. That's what these ladies are learning.
One of the things that we talked about, that I've talked about with some of the participants, is that if they go up and down the stairs at least 10 times in a day, they'll be surprised how many steps that takes. And instead of driving to the store and parking right close to the door of the store, to park on the other end of the parking lot and take some steps.
You don't have to join a health club. You don't have to be a marathon runner. It's been shown that as little as 20 to 30 minutes of exercise 3 to 4 times a week still gives you heart-healthy benefits.
While you're on track for better health, you'll also want to steer clear of cigarettes.
Cigarette smoke damages the blood vessels to the walls, allows cholesterol to build up. One of the saddest factors about cigarette smoking is that in the last 25 years, it declined about 25% in men, but only 6% in women. We need to teach our young girls not to begin smoking.
For Maya Angelou, a heart-healthy lifestyle means taking control of every element that can affect her well-being.
I have high blood pressure, but it is contained with medicine and, of course, diet. There are ways to physically contain, if not eradicate, bad health. That is to say, have it manageable. As I do with high blood pressure, I have medicine, and so that's physical. But the main help, the main therapy, is the self-induced discipline. That is a main therapy, to decide, I want to be healthy. I will take care of myself. I will put myself on this regime, a regimen. I will watch what I eat. I will take walks. I will manage somehow to get some exercise in 3 times a week, because I am worth it.
A strong sense of self-worth is a great source of protection. That's something we get from our families, and that's something we can pass along. That's what helps teenagers like Doris's daughter Jessica make good decisions.
I just say no because I think about my future and my education, and I see that those things aren't worth being risked.
Each person must feel he is worth the best. Not I'm above anybody, but I'm certainly not below anybody. I am just too good. I am worth more. It is likely that I will have something to give to the people, to give to the world. I am worth it. So if you can have that sense, you can really see about your health.
We're going to monitor your heart rate.
To see about your health, you must look beyond your own abilities. Good nutrition, exercise, limiting alcohol, avoiding tobacco. These all are things you can do every day. But on a regular basis, you need to make sure you get the attention of a healthcare professional. Be an advocate for yourself and for your family.
You must want health. And then you can find centers which can help you to help yourself to good health.
The valves all look quite normal.
Whether you go to a particular doctor or a clinic, keep your own records about what happened when, especially what kinds of problems and treatment you've had. And it's also important to pass along our knowledge about our family's health to each new generation, along with a message of hope for the future.
Because prevention works in heart disease, we recommend that you be an advocate for your own health. Don't smoke or stop smoking if you smoke. Check your blood pressure, have your cholesterol checked, have yourself screened for diabetes, and incorporate good nutrition and exercise into your lifestyle.
Good health is something to celebrate. Enjoy getting up to exercise and choose food that's good for you. Nourish your spirit and protect your heart. Your family will follow in your footsteps. Every woman is powerful. Every woman is phenomenal.
Many people wonder where my secret lies. I'm not cute, nor built to suit a fashion model size. When I try to show them, they think I'm telling lies. I say it's in the reach of my arms. It's in the span of my hips. It's in the stride of my step. It's in the curl of my lips. I'm a woman. Phenomenal woman. I walk into a room just as cool as you please, and to a man the fellows stand or fall down on their knees. And then they swarm around me, a hive of honeybees. I say, it's the joy in my hand. It's the smile of my teeth. It's the swing of my waist. It's happiness in my feet. I'm a woman. Phenomenally. And now you understand just why my head's not bowed. I don't shout or jump about or have to talk too loud. When you see me walking, it ought to make you proud. I say it's in the curl of my hair, the palms of my hands. It's in the bend in my arm. It's in the need for my care, because I'm a woman. Phenomenal. Phenomenally. Phenomenal woman. That's all the women. All women. And today I'm talking to African American women who are God-blessed and so phenomenal. Look after yourselves. My name is Maya Angelou.